More than half of the men watching this video right now are living with a ticking time bomb in their lower abdomen, and it has nothing to do with cancer. If you are over the age of 60 and find yourself mapping out every rest stop on a road trip, or waking up 3 times a night just to squeeze out a weak, frustrating trickle, you have been told that this is just a normal part of getting older. You have been told to just take your prescription, accept the slow decline, and live with it. But what if I told you that some of the most common habits you practice every single day, habits your own doctor probably hasn't even asked you about during your brief 15-minute Medicare visits, are actively making your prostate swell and your bladder suffer? I am Dr. Carl. I have spent the last 16 years practicing as a urologist, helping thousands of men reclaim their sleep, their freedom, and their confidence. Today, we are going down the rabbit hole of what is really happening behind the closed doors of your doctor's office, covering 8 critical things you aren't being told about your enlarged prostate. We are going to break down the hidden triggers hiding in your medicine cabinet, the exact reason your afternoon habits are ruining your nights, and the truth about those expensive supplements you see advertised on television. Pay close attention to number 5 on our list, because it involves a very common mistake men make with their daily routine that can completely lock up your bladder without warning. Before we dive into the first item, I want to ask you a quick question. Drop a comment below and let me know how many times you are currently getting up in the middle of the night to use the bathroom, and what city you are tuning in from. I read every single comment personally, and your real-life experiences directly shape the guides and insights I cover in these videos. Let's start with the first thing your doctor might have overlooked, and it is sitting right on the shelves of your local pharmacy counter. It is the hidden danger of over-the-counter cold and allergy medications, specifically antihistamines and decongestants. When your nose is running or your seasonal allergies kick in while you are out on the golf course, it is natural to grab a standard allergy pill. But here is what is actually happening inside your body. Your bladder is a muscular sac, and at the very base of it sits your prostate, wrapped around the urethra like a collar. Antihistamines work by blocking certain nerve signals to dry up your nose, but those exact same nerve signals are what tell your bladder muscle to contract and push urine out. At the same time, over-the-counter decongestants cause the smooth muscle tissue inside your prostate to squeeze tightly shut. It is like trying to hose down your garden while someone is standing on the garden hose with full force. A study published in the Journal of Urology highlighted a significant rise in acute urinary retention, a medical emergency where you suddenly cannot pee at all, among older men using these common over-the-counter drugs. If this is you, my clear action step for you this week is to carefully audit your medicine cabinet. Look for active ingredients like diphenhydramine or pseudoephedrine. Before you take anything for a cold or allergy, have a direct conversation with your primary doctor or urologist to find prostate-safe alternatives that won't compromise your bladder. Next up is something that feels incredibly innocent, but it is destroying your sleep cycle. It is your evening fluid habits, particularly what you drink after 5 o'clock in the afternoon. Many active seniors love to unwind with a large glass of water, a diet soda, or even a healthy cup of herbal tea while watching the evening news or reading. But as we get older, our kidneys change how they process fluids, and an enlarged prostate dramatically compounds the issue. Think of your bladder like a balloon that has lost its elasticity over the years. When your prostate is enlarged, it keeps the bladder from emptying completely, meaning you start the night with a balloon that is already half full. When you dump another 12 to 16 ounces of fluid into your system late in the evening, that half-full balloon reaches its limit within just a couple of hours of you falling asleep. Research from the American Urological Association shows a clear link between late-day fluid distribution and severe nocturia, which is the medical term for waking up multiple times to urinate. Your actionable strategy this week is to implement a strict fluid cutoff exactly 3 hours before your head hits the pillow. Shift your hydration to the morning and early afternoon so you can give your body ample time to process that fluid while you are still upright and moving. Of course, always maintain your overall daily fluid goals to keep your kidneys healthy, and discuss any major shifts with your physician if you have underlying heart or kidney conditions. Our third item tackles the massive, multi-billion-dollar world of over-the-counter prostate supplements, specifically saw palmetto and those heavily marketed prostate blends. Walk into any pharmacy or supermarket, and you will see walls of bottles promising to restore your flow and give you the bladder of a 30-year-old. It sounds wonderful, but let's look at the actual science of what happens when you swallow these pills. The theory is that certain plant compounds can inhibit the hormones that cause the prostate to grow. However, a major review by the Mayo Clinic analyzed multiple high-quality clinical trials and found that saw palmetto performed no better than a sugar pill, a placebo, in relieving the urinary symptoms of an enlarged prostate. Many of these supplements are completely unregulated, meaning you are paying out of pocket for expensive bottles that contain very little active ingredient or ingredients that don't do what the label claims. My recommendation for you this week is to save your money and stop buying into the late-night television hype. If you want to explore natural options, look into clinically studied extracts like Pygium africanum or beta-sitosterol, but do so under the guidance of your doctor. Do not stop any prescribed prostate medications in favor of a supplement without a thorough discussion at your next annual physical. Moving on to number 4, let's talk about an everyday habit that many active, retired men love, but that can silently congest your pelvic floor. It is prolonged sitting, whether that is spending hours in a golf cart, driving long distances to visit the grandkids, or sitting in a comfortable leather recliner reading the paper. When you sit for extended periods, the physical weight of your upper body presses directly down onto your pelvic floor muscles and the delicate blood vessels surrounding your prostate. This creates mechanical pressure and reduces healthy blood circulation in the pelvic basin, leading to what we call pelvic venous congestion. The prostate becomes engorged with sluggish blood flow, which can temporarily exacerbate your urinary symptoms, making it much harder to start your stream when you finally stand up to use the restroom. Clinical observations suggest that men with sedentary routines report higher scores on prostate symptom indexes. Your actionable task this week is to implement the 20-minute rule. Never sit continuously for more than 20 or 30 minutes without standing up, stretching, or walking around for at least 2 minutes. If you are on a long road trip, plan regular stops to stretch your legs. Keeping the blood moving through your pelvis is a simple, free way to take the physical pressure off your bladder and prostate. Now for number 5, the one I told you to watch out for. This involves the surprising relationship between certain blood pressure medications, particularly diuretics or water pills, and the timing of your daily routine. Many seniors take a diuretic like hydrochlorothiazide or furosemide to manage their blood pressure or fluid retention. These medications are fantastic for your cardiovascular system because they force your kidneys to pull excess fluid and salt out of your bloodstream and dump it into your bladder. But if you take that water pill too late in the afternoon or evening, it hits its peak performance right when you are trying to sleep. Your bladder is suddenly flooded with urine at an overwhelming rate, forcing you to make desperate, frequent trips to the bathroom all night long. Combined with a physically enlarged prostate blocking the exit, this creates a recipe for absolute misery and profound sleep deprivation. A study in the Journal of Clinical Hypertension confirmed that altering the timing of diuretic administration can vastly improve nighttime urinary symptoms. Your specific action step this week is to look at your prescription bottles. If you take a diuretic and find yourself drowning in nighttime bathroom trips, do not stop your medication under any circumstances, but do call your doctor's office and ask if it is safe and appropriate for you to shift your dose to early morning. Changing the timing can transform your nights while keeping your blood pressure perfectly controlled. Number 7 introduces a factor that is often ignored at the dinner table: the role of chronic low-grade inflammation driven by specific dietary fats. When we enjoy fried foods, heavily processed meats, or meals cooked in highly refined seed oils, our bodies metabolize these foods into pro-inflammatory compounds. The prostate is highly sensitive to systemic inflammation. When your body is in a constant state of mild inflammation, the tissue inside the prostate can become irritated and swollen, further compressing the urethra and worsening that frustrating stop-and-start urinary stream. Many urological reviews suggest that diets rich in anti-inflammatory fats, like the omega-3 fatty acids found in wild-caught fish, walnuts, and extra virgin olive oil, are associated with better urinary health scores in aging men. Your clear action step this week is to consciously introduce more healthy, anti-inflammatory fats into your weekly menu. Try replacing 1 or 2 red meat dinners with a high-quality piece of salmon or a fresh Mediterranean-style salad drizzled with premium olive oil. When you have an enlarged prostate, the bladder muscle has to work incredibly hard to push urine past the obstruction. Over time, the bladder muscle becomes fatigued, and it often gives up before the bladder is completely empty, leaving behind several ounces of residual urine. This is why you often feel like you have to pee again just 10 or 15 minutes after leaving the bathroom. Double voiding is a simple behavioral technique designed to empty that remaining fluid. When you go to the bathroom, urinate normally without straining. When you think you are finished, stay right there. Relax for 30 to 60 seconds, lean slightly forward, breathe deeply, and then try to urinate a second time. You will often find that a significant amount of trapped urine comes out. Urological guidelines recommend behavioral techniques like double voiding as an excellent, non-invasive way to improve bladder emptying and extend the time between your bathroom visits. Your action step is to practice this technique every single time you urinate this week, especially right before you go to bed. To show you how these pieces fit together in the real world, let me tell you about a patient of mine named Arthur. Arthur is a 72-year-old retired corporate executive who recently moved down to a beautiful golf community in Naples, Florida. When he first came to see me, he was deeply discouraged. He loved playing 18 holes with his friends, but he was constantly running to the clubhouse bushes. Even worse, he was waking up 4 times a night, leaving him exhausted during the day and strained in his marriage because he kept disturbing his wife's sleep. His primary care doctor had put him on standard prostate medication, but it wasn't providing enough relief, and Arthur feared he would have to give up his active lifestyle entirely. When we sat down and looked closely at his daily routine, we uncovered 3 major blind spots. Arthur was taking his blood pressure water pill at 4 in the afternoon. He was drinking 2 large glasses of iced tea while watching the nightly news, and he was taking an over-the-counter allergy pill every single morning to deal with the local pollen. We worked systematically to change his habits. With his primary doctor's approval, we moved his diuretic to 8 in the morning. We established a firm fluid cutoff at 7 in the evening, swapped his allergy medication for a prostate-safe alternative, and taught him how to use the double voiding technique. Within just 6 weeks, Arthur came back to my office a completely transformed man. He was down to waking up just 1 time a night. His energy levels skyrocketed, and he was successfully playing full rounds of golf without a single frantic dash to the restroom. He didn't need invasive surgery. He just needed someone to look at the whole picture. If you want to achieve results like Arthur, let's establish tonight's plan with 5 simple, concrete action steps you can start right now. First, check the labels on all your over-the-counter cold and allergy medications to ensure they don't contain bladder-locking ingredients. Second, set an alarm on your phone for 3 hours before bedtime as a hard reminder to stop drinking fluids for the night. Third, practice the double voiding technique before you go to sleep tonight to ensure your bladder is truly empty. Fourth, stand up and walk around for 2 minutes for every 30 minutes you spend sitting in your favorite chair or driving. Fifth, call your doctor's office tomorrow morning to review the timing of your daily medications, especially if you take a diuretic for blood pressure. Implementing these steps can dramatically improve your quality of life, but there is another hidden factor we haven't touched on yet that could be secretly undermining your bladder health every morning at the breakfast table. In my next video, I am going to reveal the single most common morning beverage that millions of seniors drink daily that aggressively irritates the bladder lining and mimics the symptoms of a worsening prostate. I am Dr. Carl. Stay well, and I'll see you there.